If you're in human resources or in any way responsible for your company's benefits, I got a little quick exercise for you. Close your eyes. No, really close them. I'll keep mine closed. Now I want you to think back to last month. How many people came to you with questions around your healthcare benefits? It could be just to understand them better, or it could be because there's a problem. Bill was denied. Now think about the amount of time you spent working on those issues. Who you had to call, whether it's insurance company, your benefit broker, just how you had to answer those questions. And then finally, as you think about that, how do you feel? What emotion does it inspire? All right, you can open up your eyes. In this episode of Healthcare Hacks, I'm going to talk about what you can do to help your employees navigate the healthcare system that might save you some time and get rid of some of that angst and uncertainty you have when answering their questions. Hi, my name is John. I'm your healthcare hacker and a natural stress reliever. Before we get started today, please take a minute, like this video, and follow Athos Health on all your favorite social media channels. We want to get our message out. We want you to have the latest healthcare hacks and ways to navigate our complex U.S. healthcare system. In my job, I get to talk to a lot of people in human resources and benefits. And what I find is, when I walk them through the same exercise I had you do at the beginning of the video, I'm hearing some common themes. First off, probably the most common type of question that most human resources individuals get is around healthcare. And the number of questions anecdotally is increasing, right? So there's been more questions this year than last year's because I think our healthcare system is getting more complex. Secondly, this takes a ton of time, right? If you think back to last month, my guess is you spent hours dealing with issues, whether that's on the phone with the benefit broker, researching a policy, talking to your employee. That's time that's being taken from other activities you could be doing. And finally, what's really interesting is many people that have to deal with employee benefits and healthcare, it causes them a lot of stress, right? It's complex, especially as plans have gotten more complex over the time. Individuals don't know how to answer it, right? I talked to one professional who is just afraid. They want to help the employee, but they don't want to give them the wrong answer because it can be dramatic, thousands of dollars. So what can you do? Well, unfortunately, most of us under the age of 65 get our healthcare insurance through employers. That puts you on the front line. I know I wish it wasn't that way, but it is. One resource we have, and I'm going to put it in the description below, is a white paper that talks about the top 10 questions that we see from employees and efficient ways that human resource individuals can answer those questions. It's free, download it, and use it as a reference guide. I'd also recommend hiring an AFC company. Now, I know this comes across incredibly biased and self-serving since I'm the founder and run an AFC company, Athos Health. But I do it for a reason. I think it is really important and a need in the marketplace for your employees. If you think about it, when we do our taxes each year, most of us hire a third party. We don't do them ourselves. For me, it's just too complex. I don't understand all the rules and regulations and how to jump through the hoops. So whether it's TurboTax or an accountant, I get help on my taxes. But most of us don't get help on our health insurance or healthcare costs, which is kind of surprising because when you think about it, last year in 2020, the average family of four spent more money on health insurance than they did on income tax. It's crazy. They spent $20,000 between what the company paid, what they paid for insurance and out of pocket. And they don't have anyone really helping them navigate it. That's where, whether it's Athos or any third party AFC company, I'd strongly recommend you looking into them because it's an important resource that your employees need. In the end, when things go wrong, right? If you think about incentives, you have an insurance company who's incented not to pay claims. You have the hospital or provider that wants to get paid for their services, wants to get paid, and the employee gets stuck in the middle. And when the employee gets stuck in the middle, since they get their health insurance through the company, a lot of times human resources get stuck in the middle. And that's where advocacy, a company like Athos, can come to help. We can take that burden off you and your employee to help mitigate and navigate between those conflicting interests of the insurance company and the hospital so that the employee doesn't get stuck with the bill. All right, close your eyes one more time. Now think about the last time someone came and asked you a question about healthcare. And instead of doing what you had to do, all you do is give them a phone number or an email address and say, contact these experts, whether it's Athos Health or a third-party advocacy company, and knowing that they're going to get the expert help that they need. Well, if you have any questions or comments about this episode, please leave them in the comments below. We love to hear from you. We'll try to address any comments or questions you have in future episodes of Healthcare Hacks. And as always, make sure you get the facts by joining me in the next episode of Healthcare Hacks.